Alzheimer's disease is a complex neurological disorder that affects millions of people worldwide. It is a progressive and degenerative disease that primarily affects memory and cognitive function. The cause of Alzheimer's disease is not yet fully understood, but there are several factors that are believed to contribute to its development, including genetics, lifestyle, and environmental factors. Pathophysiology. The hallmark feature of Alzheimer's disease is the accumulation of two types of abnormal protein deposits in the brain: beta-amyloid plaques and tau protein tangles. These deposits lead to inflammation and damage to neurons, eventually resulting in the loss of brain tissue and nerve cell death. Beta-amyloid plaques are formed when beta-amyloid protein, which is a normal component of the brain, accumulates in the spaces between neurons. Over time, the beta-amyloid protein clumps together and forms plaques, which can disrupt the normal functioning of neurons and cause inflammation. Tau protein tangles are formed when tau protein, which is responsible for stabilizing microtubules within neurons, becomes abnormal and clumps together in the neurons. This causes the microtubules to collapse, resulting in the death of neurons and the formation of tangles. Symptoms. Alzheimer's disease typically begins with mild symptoms, such as forgetfulness and difficulty with everyday tasks. As the disease progresses, symptoms become more severe and can include confusion, mood swings, language difficulties, and eventually, the loss of bodily functions. Memory loss is a hallmark feature of Alzheimer's disease, particularly with regards to recent events and information. Diagnosis. Diagnosing Alzheimer's disease can be challenging as there is no single test that can confirm the condition. Instead, doctors typically use a combination of tests and assessments to evaluate a patient's cognitive function and rule out other conditions that could be causing symptoms. These may include cognitive and memory tests, brain imaging, and blood tests. Treatment. While there is currently no cure for Alzheimer's disease, there are treatments available that can help manage symptoms and slow disease progression. Medications such as cholinesterase inhibitors and memantine can be prescribed to help improve cognitive function and delay symptoms. In addition, lifestyle modifications such as exercise, a healthy diet, and social engagement can also help improve overall well-being and slow disease progression. It is important to understand Alzheimer's disease and the impact it has on patients and their families. While there is still much to learn about the disease, advances in research and treatment offer hope for better understanding and management of this devastating condition.